Good afternoon. I'm Ahuva Weiss-Meilik, and I'm the head of the data science in Tel Aviv Medical Center. During the last year, Tel Aviv Medical Center puts a lot of effort in order to build a wide state-of-the-art big data infrastructures and AI-based mathematical models. In the next minutes, I would like to present a few of our initiatives. In 1950, the fundamental internal medicine textbook Harrison was first published. At the first chapter, the editor writes that the practice of medicine is a combination of science and art. So, after a whole essay about science, comes one single sentence about art. He describes art as a combination of knowledge, intuition, and judgment. According to the author, science and art are the component of good medical practice and actually responsible for all the clinical decisions. Recently, along with the ability to collect mass computerized medical information, we have to take into consideration a new player in the field, the data. Kind of noble savage with powerful, strong, and fast characteristics. Now, we are starting to domesticate it, we learn it, and mainly trying to adjust it to our systems. It is going to be an essential component in clinical decision-making. This new player helps us to make a decision with a new twist, predicting outcomes and improving them along the way, kind of online, using multivariance mathematical models. Those models are much too complicated for the human brain. Therefore, even not the best clinician is capable of taking this information into account while using the old methods. Up until today, we, like all other equivalent medical centers, used to work with common SQL data warehouse. Significant amount of data was processed to a certain extent and is kept that way, since that some information cannot be used in its raw state. Traditional data warehouse like ours cannot be used for models like AI, machine learning, deep learning, NLP, image processing, etc. In order to make the leap, we use advanced mathematics. We implemented advanced platforms such as Hadoop, Cassandra, that can store the raw data. In order to create this data lake or data ocean, we collect all of the data from each patient that allow us to use and conduct those models and calculation. I will now present a few examples of some of our ongoing projects, still in development. The aim of this project is to predict deteriorating of premature baby hours before physician can detect it. We targeted drawing blood for culture as a sign of early deteriorations, since culturing is the first step in every premise move. Every documented information was transferred to the data lake, clinical information, and all the data from the monitors, like blood pressure, heart rate, temperature, oxygen level, etc. Using modification of mathematical models developed by Robert Shirayev, we developed an algorithm predicting the deterioration many hours before the clinical signs. Take this preemie, for example. She was born as a twin on week 24, weighed only 532 grams, and was ventilated during her stay. Her length of stay was 142 days. Now, every blue dot represents a 15 minutes heart rate average. Surprisingly, this data alone was a very good predictor for later deterioration. The red line shows the time blood was drawn. And the red dots indicate the machine learning, the alert. The preemie was treated with non-steroidal anti-inflammatory drugs, NSAIDs, due to cardiac defect, PDA. Every neonate is born with natural vascular shunt from right to left, which is closed by itself around the delivery. Since this neonate was born as a preemie at week 24 of gestation, we had to administrate non-steroidal anti-inflammatory drugs in order to close the vascular shunt medically earlier. One of the side effects of NSAIDs treatment is reducing also the diameter of other blood vessels, even closing them. As shown in this case, NSAID treatment led to edema, renal failure, and acidosis. The necrotic wound probably caused elevation in white blood cells count level. As time goes by, you can see she's getting better by all the parameters and stronger. One day, when all the physiological parameters look normal and stable, the machine, the algorithm, gave an alert. That was 18 hours before blood was taken, deterioration started. Later that day, only after seeing the first signs of deterioration, blood was taken and sepsis was diagnosed. We believe that early response to those early signs, by starting antibiotics earlier, would have the potential improving clinical and other outcomes, and also reduce expenses and facility usage. The end was happy. The preemie survived. The aim of another project, a collaboration with several companies, is to predict deterioration of patients hospitalized in internal wards. Those specific patients are at risk because they are not monitored constantly by machinery or being closely looked by medical staff. Deterioration is preventable if alerted on time. Here we are using a IoT, a wearable device that continuously monitoring blood pressure, heart rate, oxygen level, heart rate variability, cardiac output, and respiratory rate, parameters that are not being monitored routinely. The monitored patient can be mobile and does not have to be restricted to bed or power source. And virtually, he becomes step-down unit patient, kind of intensive care. The physiological parameters are transferred to our big data platforms. There, they are blended with clinical information. This unique setup gives us the full view of patient's condition. The data lake enables us to activate machine learning models in order to detect deterioration, where the algorithm targets are several physiological and clinical parameters that are related with deterioration. Pay attention to that illustration. Recently, medical study note that one of the parameters we have to take into account when trying to evaluate potential deterioration is nurse gut feelings. A nurse might report that she has the feelings that this patient is going to be deteriorated soon. Nowadays, we are cooperating with AnyVision, is a company dealing with face motion detection, trying to develop facial recognition methods with camera, of course, in order to detect changes in patient health condition, skin tone, sweating, mimics, etc. This facial data should be part of our complicated algorithm. At the end of the day, an alarm should be sent to all of the medical staff or any other points of interest in order to prevent the potential deterioration. The last project that I will present you, we are developing now is trying to predict appending morbidity conditions using lab tests. What is the big deal, you may ask? Lab tests should give us the information about current morbidity. So please pay attention. A young man with atrial fibrillation arrives to ER. Let's take a close look. He is 45 years old, married with 2 kids. He complains about palpitations and shortness of breath. This guy admitted to one of the hospital wards, and over there, the doctor detects atrial fibrillation, a type of cardiac arrhythmia. Low blood pressure, but still in the norm, normal lab test, and chest radiography. The patient gets a chemical cardioversion in order to regulate his heart rate. 3 days later, he is discharged with follow-up visit within 30 days. In the background, In the background, machine learning algorithm running. Now, although all the lab results are within the norm range and the patient is asymptomatic, the algorithm recognizes some interactions between the lab parameters and differences between one of them and the norm range. The machine alert that this patient is going to develop infectious disease. The machine alert that this patient is going to develop an infectious disease. And you might want to consider to start antibiotics earlier before or prophylactics. Those examples are only the tip of the iceberg. We, in the Center for Data Science in Tel Aviv Medical Center, have made it our trademark to change the medicine through artificial intelligence. As mentioned before, the Center for Data Science has a lot to expand data infrastructure by creating sandboxes and advanced platforms on the cloud. Using the cloud enables us to expand the storage and calculation abilities, which allow the data scientist to develop database products, meaning algorithm in which the purpose is to create an added value to medicine. The main and most important layer which the AI developments rely on is the complete set of assets acting together as an ecosystem. Hospitals, patients, management, labs, procedure, etc. Our unique value is a professional ecosystem that lead the process from the initial idea up to development of complex algorithms. The ecosystem is under constant interaction with the industry, academy, Ministry of Health, and of course with the innovation leaders in our medical centers. Our pillars, 6 pillars, here they are. The first is the clinical domain, which holds chosen clinical areas within high digital information. Our goals are to develop AI in different fields and levels of complexity. A significant challenge is to assemble all these elements into smoothly operating innovation center, a hub for innovative ideas and startup companies. The hub provides support starting from idea phase up to the beta site product. The hub operates as a center that works in a holistic approach that addresses the needs of the projects, like the following: annual budget, legal and intellectual property, business, working space, hardware and software, technological support, data science consultation, medical wisdom, etc. A mature project with a proof of concept will also be supported in financial and commercial aspect. Indeed, the center is operating as a living lab. These are the companies and organizations we are currently, these are the companies and the organizations we are currently cooperating with. Thank you.